Hi, Caleb with Brownells here, back again with Chris from North American Rescue. And in today's video, Chris, we're going to be taking a deep dive into the actual contents of the first aid kits. And kind of answer some questions here, because I know like when you purchase it, you have everything nice and wrapped up in packaging. Do you need to open those packagings? And just kind of answer questions like that and actually show what's actually in there. So take us through it.
All right, so we'll start with, this is the M-FAK roo, and on the outside of this kit we have our tourniquet. We have our tourniquet out of the plastic. It is covered, so it is ready to go. If we're on the range and something was to happen, I can easily flip it and start access my cat tourniquet.
Yep.
And apply it. All right.
Easy enough, and it's called a roo because the pouch is on the front.
Very good, yes.
You didn't connect that yet.
When we go inside, we're going to have our gloves. Nothing on the inside needs to be open, right? It's all sterile, right? So we don't want it to, we don't want to open it, and in the case of the HyFin, we'll dry out the chest seal, right? So we want to leave it as it is. So we'll start with our HyFin here. It is a twin pack, so we have two of them for an entrance wound and an exit wound. So we take our tear notch and we rip that, and we open it up. We have our 4x4.
Yep.
And now we're going to put this on the bare chest.
Okay.
Okay. So we want to, if something happened, we're going to take our expose them, and we're going to wipe away the blood from the bare chest. We're going to take the HyFin Chest Seal and we're going to apply it right over. So we take it, we peel it, and then we stick it onto the bare chest, right? We want to put, it is a tri-chambered seal. So we have the hydrogel there, and then the chamber lets air out but not in.
Right.
All right.
Yep.
So and then we use the hydrogel and we stick it onto the chest.
Easy enough.
Okay.
Yeah, and I've been in some classes where they've taught you how to make them out of just like plastic sheets and tape, but that's way more convenient.
Yes, it's easier to do than try to make something, especially on the fly.
Yeah.
And probably nobody, you don't have the items readily available as you're trying to treat somebody that something just happened.
Yeah, high stress situation, it's better just to have it built.
Yeah. So we have, we opened our one, but luckily we checked our back. We didn't have an exit wound, so now we still have this for another day, hoping we never need it.
Perfect.
Okay. All right. We have our Combat Gauze LE, so we have it here. So again, we don't want to open this when we receive it, but we're going to show you what it looks like. So all it is Z-folded gauze, and we're going to go over wound packing in a later video.
Yep.
Has a blue line for X-ray. The kaolin is the hemostatic agent on the Quick-Clot Combat Gauze, and we're going to pack that into the wound. All right.
All right, yeah, so the blue line for x-ray, that's whenever the patient actually gets to the hospital and they're doing x-ray, they know there's gauze in there.
That's correct.
Yep, so
Yep.
perfect.
The X-ray, it's going to be there. All right. And then the last thing we have is our pressure dressing. We call it the emergency trauma dressing. You'll hear people use the word Israeli dressing as a overall arching for pressure dressings. That is an actual specific pressure dressing. Again, we have the emergency trauma dressing. So when you open it up at the tear notches, it's basically a ACE wrap with a pad already on it. So we're going to, if this is your injury, you don't need a tourniquet, but I need to put some pressure on it. Now, Band-Aid ain't going to do. We're going to put this on and we can wrap it. And then you see if I drop it, it doesn't all the way unravel.
Yep.
Right? So, and then I can continue wrapping. And then at the end, we have a clip here, and secure it. We're gonna grab it there, and then grab it there, and we're all good. All right?
Yep, nice and secure, easy enough.
Okay.
And, kind of funny story with these, you never know when you're going to need them. I was actually working in the gunsmith shop, just changed sights on the guy's handgun. It was his carry gun, so he went out into the parking lot and went to chamber around to kind of store everything. Like I said, it was his carry gun, and sent one through his upper leg and exited out of his lower leg. So he came hobbling back into the gun shop and needed a pressure dressing while we waited for the ambulance. But he was okay. Fortunately, we were able to get him taken care of while we waited for the ambulance or EMS. And yeah, so you never know when you're going to need it, especially in this profession. So
Very good.
good to have.
All right. The only other questions we get a lot, do things expire? The chest seal is going to have a 5-year expiration date. It has hydrogel, so, and then the Quick-Clot as well is going to have a 5-year expiration date.
Okay.
Okay.
Yep. Good information there. And so the only thing we need to open when we receive the first aid kit is just that tourniquet.
Yes.
Take it out the plastic and leave everything else as is.
Yeah. Some other things you might want to think about that you might want to add to your kit, if you get something like that, is this doesn't come with trauma shears, so you may want to add some trauma shears.
Yep.
So that you can expose the wound, or you got to cut off your shirt, so we can see that, you know, that penetrating injury to your chest or back. So we make sure we can see it all, or maybe a second tourniquet. Reholstering a weapon, shoot yourself in the thigh. People with large thighs, sometimes they need that second tourniquet to control the bleeding. So that may be another thing to think about.
Yeah, so some good add-ons there. So in addition to your first aid, your standard first aid kit, you know, some add-ons there would be another tourniquet and of course some trauma shears. And from there, you'd be pretty well set up.
Yeah, people ask me all the time, is this good for one patient, two patients? It really just depends on the injury, right? Here we have an isolated injury where I didn't need a tourniquet, so, you know, I still have the tourniquet for another day, and a chest seal still. So it really just depends on the injury on the patient. So, you know, if you go to a motorcycle accident and you may need a couple tourniquets and pressure dressings and, you know, and wound packing. You never know. It just really depends on the injuries to the patient.
Sure. And another thing that goes really well with first aid kits is training. So if you haven't already, seek out some training. You can check out stopthebleed.org. There's a lot of excellent resources there. And you can also reach out to North American Rescue directly. So if you have any questions or comments, feel free to post them down below or give us a call on the tech line. Thanks for joining us, and we'll see you next time.